Good afternoon or good morning, wherever in the world you are dialing in from. Thank you so much for joining today. We're very excited for today's session, Medicare 101 for your business and your eligible employees. We have just an amazing cross-section of experts and information for you to help prepare you as a business owner and as a business leader to better understand Medicare and what it means for your employees. So we're just really excited that you're spending a few minutes of your day with us, and we really do have a fantastic presentation ready for you. In the meantime, as we're letting folks start to file into the Zoom room, if you could go ahead in the chat, let us know your name, the name of your business, and where in the world you're dialing in from. And since we just had Halloween, what Halloween candy you are eating today or your favorite. And we'll just get started here in 1 minute. We're just letting people start to file into the Zoom room. But thank you for joining us today. We're very excited for today's presentation. And again, if you didn't hear me, go ahead in the chat. Let us know your name, the name of your business, where in the world you're dialing in from, and your kind of favorite Halloween candy since it was just yesterday. And we're starting to see folks from Chicago, Iowa, oh my gosh, Alaska, no candy, Georgia, California, all around the world. Oh my goodness, look at that. Chicago is the candy capital of the world. Tennessee, just amazing. Well, we want to be mindful of the time here and that you all have taken about an hour of your day out to spend it with us. A few quick pieces of housekeeping. We know folks are going to have questions. We want to encourage you to have questions. But what we would ask is that you do that via the Q&A button. Just know that allows us to better track your questions and respond to them. And so again, use that Q&A button to ask any of your questions. And finally, this session is being recorded. And so we will share this recording out afterwards via the email that you registered with. And get you all the information that you need, as well as a number of different resources that we have mentioned here today. And so with that, it's my honor to introduce kind of two experts today. First, we have Xavier Vaughn, Program Manager for Medicare Education from ARP. And we also have Maggie Flowers, SHIP Program Manager from the Administration for Community Living. Maggie will come on a little bit later and talk about the SHIPs in more details, but also be able to answer any of your questions. But first, we have the amazing Xavier up to really dive deep into what Medicare is and all the different components. And so, Xavier, turning over the proverbial microphone over to you to get us started.
Thanks, Colin, and thank you all for joining today on this first day of November. I hope you all have had a great week so far. So today, we're just going to be going over a few basics with Medicare, educating your employees on Medicare and resources and tools that may be available to them and to you as they make choices for not only themselves, but also for their loved ones. Okay. Let's see. So a common question that we may have is, what is Medicare? What's covered? When should you enroll in Medicare? What happens if you don't? How will Medicare work with your existing health coverage? There's so many different things that questions people may have. And right now, with it being open enrollment, you're being inundated with mail and the TV ads. I think a lot of questioning comes up during this time. Okay. So your role as a business owner is to provide your Medicare eligible employees with educational material pertaining to Medicare. Also connect them to different resources that are available in their in your area. Later on in the presentation, we'll go over some of those resources that are available to you. And make sure that your employees don't have any penalties when it comes to Medicare. If you don't enroll when you are eligible, then you could face some penalties, and those penalties could last for a lifetime. So it's really important that you are aware of all of these rules, or if you're not aware, that you can point your employees into the right direction and where they can get those. And yes, you will receive a copy of this presentation, and it is being recorded. So what is Medicare? I know that is a question that we all have, is a question I know we all want to be on Medicare. So Medicare is a federal health insurance program for people who are age 65 and up, under the age of 65 with certain disabilities. And so with those disabilities, you have to be receiving SSDI payments. And at that 25th month, you'll be automatically enrolled into Medicare. Also, if you are age 65 and already collecting your Social Security, you will be automatically enrolled into Medicare. But if you're 65 and still working, and so you're not collecting those Social Security benefits, then you will not be automatically enrolled. If you have end-stage renal disease, also if you have ALS, you also qualify for Medicare. And for those programs, you will have to enroll. So what are the employee responsibilities when it comes to Medicare? They're really going to be the same responsibilities that they currently have with their employer-sponsored healthcare, right? You're going to have your monthly premiums, your deductible, your co-insurance, your co-payment. So you're still going to have to pay that monthly amount that you have. You're going to have to reach that deductible before things can maybe be paid for more. Co-insurance, co-payments. So you may have to either cover a certain percentage of your medical bill, or when you go to a doctor, you may have to pay a 25 copay to go see your primary and different things like that. So all of this should feel very familiar to your employees. So what does Medicare does not cover? Original Medicare does not cover hearing, dental, vision, or long-term care. And I know as we age, there are some of the things that we are maybe looking forward the most, right? We know our vision may become worse. Looking to think, oh, if I need to go to a long-term care nursing home or things like that, that is not covered. But it is important to note that some of these things could be covered in a Medicare Advantage plan, and we'll get into more detail on that a little later on in the presentation. So the different parts of Medicare, you may hear Medicare referred as Medicare soup, or or trying to figure out how all the puzzle pieces fits together. But it can be quite complicated. So part A is going to be your hospital insurance. And so what does part A cover? Part A will cover a semi-private room and meals, nursing services, drug supplies and other hospital services, lab tests and x-rays, some blood transfusion, inpatient rehab services, and most hospital services for the first 60 days. It can also cover some skilled nursing care as well. And so, and you will notice that in this presentation, we will be talking about costs for the year 24. And so in the for next year, there typically, in general, there typically is no premium for Part A. Part A is something that we pay into. As you know, we have the Medicare tax, you pay into it. So as long as you work for about 10 years, you typically will have a premium-free Part A. For example, I am 29 and I already would have a premium free Part A. I paid enough, I have enough work credits in order to qualify for that. The deductible for next year will be $1,632 for the first 60 days of inpatient care. And the deductible can be applied again for additional hospitalizations after the 60 days. So that's really important to note. And it's also important to note if someone that you are working with, if they haven't worked enough, don't have enough work credits, that they can also draw upon a spouse as well. Also, it's important to know Part A does not cover TV or phone services, a private room unless it's medically necessary. Services you receive from doctors while you're in the hospital are covered under Part B, which we're about to get into in long-term care. So for Part B is going to be your medical insurance. So these are going to be your doctor visits for your primary care. You have annual preventive services, such as your flu shot or your wellness visit, mammograms, clinical labs, such as blood and urine tests, CT, MRIs, some health programs, such as cardiac rehab, obesity training, and smoking cessation, physical, occupational, and speech therapy, diabetes care, including screening, the preventive services, and educational, your mental health services, your durable medical equipment. These are things like your wheelchairs and walkers, and emergency department outpatient same-day surgery services. Part B does not cover eye exam, eyeglasses, and most contact lenses, hearing aids for fitting them, or dental exams, and most prescription drugs. Sorry, I think my screen doing dual screens, I think it might have froze a little bit, so let me go back. Okay. So your cost for Part B is your will for next year will be $174.70. That is about, I think, a $9.80 increase from this current year. Premiums will go up higher for individuals if they have income for more than 103,000 for an individual or 206,000 for incomes. For couples, there is a 2-year look back. And if for some reason your income has changed quite a bit in those 2 years, you can file an appeal, but you don't have to pay that higher premium. And there is an annual deductible of $240 per year, and there is a co-insurance for 20% for most services. So if you were to go to the doctor, to your primary care, you would have to pay 20% of that cost. And I was saying earlier, Part A is hospital, Part B is medical. How I like to remember which one is hospital, which one is medical. If you put them in alphabetical order, hospital and medical, they coincide with their parts. So A for hospital and B for medical. Okay, now we have Part C, also known as Medicare Advantage plans. And this is what you really see a lot on those commercials or advertisement for the Medicare Advantage plans. And they're alternatives to original Medicare. And what they do is, in this day and age, we love bundles, right? We bundle our phone, our internet, our cable all into one plan. And that is exactly what a Medicare Advantage plan does. It bundles your Part A, Part B, and most of your time your Part D, which is your drug coverage, into one plan. So they are going to be structured and feel very similar to what your employer-sponsored healthcare is going to feel like. This also, if you sign up for a Medicare Advantage plan, it may limit your ability to purchase a Medigap plan in the future. And we'll talk about Medigap plans a little later on. But if you don't sign up for a Medigap plan when it's first available to you, you may have to go through an underwriting process, or they're going to look at your health history to determine if you can get that plan. Okay, so how do they work? Medicare Advantage plans are very much, you have to deal with a plan service area. And your service area can be just as small as your county. It may not even cover the entire state. So it's really important if you are a person who travels to different parts of the country, if you're a snowbird and travel, up north for the summer, down south for the winter, that this may not be the best plan for you. These are going to have your HMOs and PPOs just like our employer-sponsored healthcare. So you're going to have to deal with in and out of network as well. You may have to have a referral in order to see a specialist. You may have to pay an additional premium upon that Part B premium in order to have a Medicare Advantage plans. And you have to follow the plan's rules, as I was talking about, for receiving a specialist. The thing with the Medicare Advantage plans is, though, they do have multiple additional benefits that people may like. Like they may include some hearing, dental, or vision. but it's also really important to look into the details to see how comprehensive that coverage is. And some Medicare Advantage plans may only cover basic or routine services, but if you look into the details, they may have where you can have an add-on to it for more money to make that plan to be more comprehensive. Other plans or other additional benefits may be transportation to for doctor visit or some home delivered meals if you come home from the hospital or something like that. So the next part we're going to talk about today is your Part D, and remember D is for drugs. And so with this, it is a standalone drug plan, very similar to the Medicare Advantage plan, how it is an insurance company, a standalone plan that you can get your services through. And now with the Part D plans, it's important to note that you may have a deductible that is associated with it. And just like with your doctor visit or doctors, how you're gonna have an in and out network, you're going to have preferred or standard pharmacies or pharmacies that are out of network. So it's really important to look at the details because that can also save you a lot of money, making sure that you're going to a preferred pharmacy that is in network. So for this upcoming year, people, you're going to have a monthly premium, you're going to have co-pays, and the annual deductible can be up to $545. Much like with Part B as in boy, how you might have to pay the higher premiums if you have higher incomes. The same is true with those with Part D. And we'll go a little bit more into open enrollment, like your Medicare Advantage plans and your Part D plans are what you can shop around during this time of year. And so this is kind of puts everything that we just talked about into a nice little chart, right? You have your original Medicare, which some people also refer to it as traditional Medicare, is going to be your A and your B. And those are what you have to have. And in order to have a Medicare Advantage plan, you still have to be enrolled in your original Medicare or Part A and Part B. The thing with a Medicare Advantage plan, it will sometimes, and most of the time, will bundle your Part D as in drug plans all into one plan. Or you can do your original Medicare and add a drug plan to it. With original Medicare, you have your A, your B, and your D. You can also add your Medigap plan to that plan. As you may recall earlier in the presentation, we said that Medicare Part B you will have to pay 20%. And so some of those Medigap plans are going to help you with that 20%. And that is also a perk of a Medicare Advantage plan where you're going to have a set copay for services, different things, and you can have your out-of-pocket max that you can see up front. So this just goes back to what I was just saying. So Medigap. So Medigap, or you may also hear it be referred to as supplemental insurance. And it does exactly what the name says. It fills in the gaps or supplement of original Medicare. These are sold by private insurance companies and they cover and you're going to have they cover some deductible co-insurance and co-pays. And you cannot have a Medigap plan and an Advantage plan. And there are up to 8 standardized plans that you can get. And it's really important to note that with a Medigap plan, as I was just saying, there are 8 standardized plans, and those plans are also going to have letters. So they're going to be plan A through N. And notice I'm saying plan and not part. So do not get plan A confused with part A. And it's important to note that you're going to have a slew of different insurance companies that are going to offer the same plan. And the thing is that each of those plans are going to cost a different amount of money. So it's really, really important to know that a G plan is a G plan is a G plan. It doesn't matter what insurance company you go with, they're all going to cover the exact same thing. So when do you buy a policy? You buy a policy within 6 months of enrolling to Part B and be 65 or older, pay a monthly premium, and it does not cover prescription drug costs or any additional benefits like hearing, dental, and vision. But where it does come in hand is if you get a certain some of the plans and you have um, a cardiac event and you have to be in the hospital for a certain amount of time, you may leave the hospital having a very small nominal bill. So they are handy in that regard. Okay. Now this is really what you probably came from. So when do I actually enroll into Medicare? And and that answer will be different for everyone involved, right? So there's a few different windows from when you can enroll. You have your initial enrollment period, which is when you first become of age, either when you first become 65, that 25th month if you're on disability, and it's sooner if you have ALS or end-stage renal disease. So that would be your initial enrollment period. Your special enrollment period, for example, would be maybe if you continue to work past the age of 65 and you decided to delay your enrollment, you would qualify for a special enrollment period. If you move to a new area, to a new state, that would qualify for a special enrollment period. Um, and we also have the open enrollment period, which is the period that we are in right now. So if you are during your initial enrollment period, you have if your employees are receiving Social Security benefits, then they're automatically enrolled, which is something we talked about earlier. And they have a 7-month period of when they can enroll. The 7-month period is 3 months before the birth month, the birth month, and then 3 months after the birth month. And it's important to note if you're born on the first, if you are in the US states, Puerto Rico, I believe, have different rules. Then your birth month is, if you're born on the first, is actually the month prior. So if you're born on June 1st, your birth month would actually be May and not June. So that would move up your 7-month period a month. And so that is something that is really important to note. And if you do not sign up for your Part B and D, even though D is technically optional, you may have to pay a late enrollment penalty. And we'll go over the penalties a little later on. So next we have a special enrollment period. And these are for employees or people who do not enroll when they are first eligible. So they get a special period of time to do it. And this period is available for those over the age of 65 employees who are currently working and are covered by employer health coverage, or employees who lose employer coverage either through the end of employment or another offer. Next, we have open enrollment, and I'm going to spend a little bit more time talking about open enrollment just because that is the period of time that we are in right now. So your annual open enrollment is October 15th through December 7th. That is the same for every person, and that is during the same time every single year. Once again, that is October 15th through December 7th. It does not matter if it falls on the weekend. It will always be October 15th through December 7th. During this time, you can make some changes to your plans. So it's, for example, if you, during your initial enrollment period or during your special enrollment period when you first sign up, you decide that you wanted to go with a Medicare Advantage plan instead of original Medicare plus a Part D plan. During this time, during open enrollment period, you can make the choice to drop out of your out of your Medicare Advantage plan and pick up a Part D plan. Or you can do that vice versa. If you're in a Part D plan and you decide that you want to go with a Medicare Advantage plan, you can make that decision at that time. Or if you want to stick with a Medicare Advantage plan, but just go to a different Medicare Advantage plan, you can do that, or go switch to a different Part D plan. This is your time to shop around, and it is highly encouraged, even if you are happy with your plan, to shop around. You can save so much money by shopping around during open enrollment period, because things can change. Just how our health needs can change from year to year, the plan can change from year to year. A plan that's cost $15 this year may be $30 the next year. Your pharmacy that you like to go to may be a preferred pharmacy this year. It may not be a preferred pharmacy for the following year. A doctor who is in network this year may not be in network next year. So it's really important to look and shop around every year and make sure that it is still a good plan for you. Also, when making a selection with a plan, it's also to make sure that you make a good selection for you. Just because you have a friend, family member, a spouse who is in a plan does not mean that that plan will still be the right plan for you. Okay, the penalties. So your Part A penalty is going to be your most forgiving penalty out of the A, B, and D. If you do not sign up when you are first eligible, you will pay up to a 10% increase for a monthly premium for twice the amount of number of years you did not sign up. So if you did not sign up for 2 years when you were eligible and should have signed up, then you will pay a penalty for 4 years. Now, Part B and D, those penalties are going to stick with you for a lifetime. And so for the Part B penalty, for each 12-month period you do not sign up, then you will have to pay a 10% penalty. So if you go 10 months without signing up when you were first eligible, you'll be fine for Part B. You will not have to pay the penalty because it has not been for a 12-month period. If you go 13 months, you will have to pay that penalty as for 1 year of penalty. But if you go for 24 months, then that penalty will not be 10%, it will then be 20%, if that makes sense. And like I said, this penalty will stay with you for a lifetime. And so that can be quite a bit of money. We know for next year, the penalty or the price is $174, right? So that will be $17.40 on top of that monthly premium that he would have to pay. For Part D, for every month that you go uncovered or do not have a credible coverage, you will pay 1% of the national average of the national base premium. And for 23, it is $32.74. And this is for every month that you go uncovered. So if you go a substantial amount of time, say if you go 3 years, that's 36% that you would have to pay on top of that premium. So you can understand where that could become a quite hefty penalty that you have to pay. I remember when I was doing one-on-one counseling with Medicare, I encountered an individual who did not sign up for a Part D plan since Part D inception. And Part D, I believe, came into law in 2006. So from 2006 to maybe about 2018, she never signed up for a plan. So she was going to have to pay a 1% penalty for all those months, for every month that she went uncovered. So, even if she enrolled into a cheapest plan, that's going to be way more than what that actual plan costs. So it's just really important to sign up for all these plans, even if they are considered optional when you are first eligible to sign up for. And it's also important to know, as we have all of these new assistance programs like GoodRx and different things that we may see on TV, that those type of programs are not credible drug coverage. So you cannot think, oh, I'm just going to use GoodRx and never sign up for a Part D plan. If you do that, then you will have to pay a penalty if you ever decided that you wanted to sign up. Okay, so Medicare and your business. Okay, so there are different rules when it comes to Medicare depending on the size of the organization that you work at or you own. So if you have fewer than 20 employees, then they must enroll into Medicare. And Medicare would become the primary insurance. The rules are slightly different if you have if you are engaged in a group health plan with multiple employee employers. So for small employers who are included within a multi-employer group health plan that has at least one employer that has more than the 20 employees, then your employees would not count in this group and would act more at like a large employer, if that makes sense. So I'm going to say that one more time. If you are enrolled in a group health plan, even if you have less than 20 employees, but one of those employers in the group health plan has more than 20 employees, then you would be exempt from this rule and would be operate more like a large group employer. So if you have more than the 20 employees, then your employees can choose to enroll into Medicare whenever they would like. So they can enroll when they are first eligible, or they can delay enrollment and then qualify for a special enrollment period at that time. And if they were to decide to enroll into Medicare, then Medicare would be secondary to their employer-based insurance. Okay, so this will just kind of go over the different options for the employees based off from the size and what they can do. So for a small employer, um, they would have to enroll in Part A and Part B during their initial enrollment period, unless they are a part of the group health plan, right? If you are in a large employee, they can enroll when they're in for their Part A and Part B when they're first eligible, or they can just enroll in Part A. As we can remember, Part A is free for most individuals, and they can delay their enrollment into Part B. Or for the next option they would have, if they can delay their enrollment into Part A and Part B. It is important to note, though, if you delay enrollment, you will have to make sure that they have records prove that they did have credible coverage, so they were enrolled into that employer-sponsored plan, just in case if Social Security will ask for it, and you will have to fill out paperwork and stating that the employee did have credible coverage in the HR department to make sure that everything is that Social Security is aware of why they enrolled. So this nice little chart gives you an overview of when things will fall for those who have their initial enrollment period. So about 6 months prior, they will receive an overview letter saying, hey, you're about to enroll into Medicare. These are some things you need to know. We know during this time, they will also be receiving their red, white, and blue Medicare card. During the initial enrollment period, we'll start, remember, 3 months prior to the birth month. And that's when you might start getting some Medicare educational pieces. Your birth month, that was when your coverage could first be started. 2 months after your birthday will be final communication with all materials. And then the third month is when your initial enrollment period closes. If you miss your initial enrollment period when you are first eligible and you don't qualify for a special enrollment period, there is a period of time known as the general enrollment period, which takes place between January and March. And during that time, you can sign up for your Part A and your Part B, and coverage would begin the following month. So it's really important when you engage with your employees on Medicare that you have clear and concise information, right? We know that this information is so confused. I know as I have been doing this presentation, I've seen all of the questions starting to come in. It can be quite confusing and it can be quite hard to fit in during a tight and small time frame. So just making sure that you have clear and concise communication. Refer employee to trusted resources, which we will go over soon, and educate employees about their Medicare options prior to when they first become eligible. You know, when that 6 month mark comes in that slide that we just talked about before, start educating them then, because they're going to start beginning inundated with Medicare material. So making sure that they know what all their options are. Okay, resources. So a great resource is Medicare.gov, which is ran by CMS. And on this website, it's where you can actively sign up for a Part D plan and for a Medicare Advantage plan. To sign up for Medicare, you would actually have to do that on Social Security's website or a local office. And on here, you can create an account. You can plug in all the medications that one takes. You can see the plans and you can sort the plans on Medicare's website where you can see the lowest cost to you. And when I mean the lowest cost, that looks at the monthly premium and the cost of your medication. So it's a really great tool that will be used that one can use. Or you can, if you don't feel comfortable going on the website yourself, you can also call Medicare and they will help you navigate. Next, we have the Medicare Right Center, which is a great resource that ARP works with all the time with answering Medicare questions. It's a nonprofit organization that is just there to provide Medicare resources. And the SHIP program is also a great resources. And Maggie is going to jump on board and kind of really talk about the SHIP and all the great work that they do.
Great. Thank you, Xavier. Excited to be here with you all today. I'm loving all of the great questions. I'm glad everyone's learning a lot. Before I hop into what the SHIP program is, I wanted to give you a little bit of background on where it's located. The Administration for Community Living is a division of the Department of Health and Human Services, and it manages the State Health Insurance Assistance Program, or SHIP. ACL was created around the fundamental principle that all people, regardless of age or disability, should be able to live independently and fully participate in their communities. ACL uses a person-centered approach to services, offering a range of community-based services through a network of state and local partners. Our programs help older adults and people with disabilities find support and services that they need in order to successfully live in their communities. That includes things like Medicare education and counseling, like today's event, or meals at home or in the community centers, or activities at senior centers. The list goes on and on. You can learn more about our programs at acl.gov. Next slide, please. So SHIP. What is SHIP? The State Health Insurance Assistance Program, or SHIP, is a community-based network of counselors who provide assistance in person and by phone, and also by web, make group presentations, and use a variety of media sources to educate people about Medicare. It's a national program. It offers one-on-one assistance to beneficiaries, their families, and caregivers to help them make those informed decisions. And help answer questions like all of the great questions you all are asking today. There are 54 ships, one in all 50 states, Puerto Rico, Guam, the District of Columbia, and the U.S. Virgin Islands. These services are typically delivered by state units on aging or departments of insurance in partnership with the local area agencies on aging or other community-based partners. Nationally, SHIP oversees a network of more than 2,000 sites and 12,000 team members, including staff and volunteers. In addition to SHIP services, many of our grantees also provide the Senior Medicare Patrol, or SMP, program services, and that program helps people with Medicare protect, detect, and report healthcare fraud, errors, and abuse. SHIP recruits and trains both volunteers and in-kind team members, and they can help with a variety of things. They are highly trained and certified to assist with obtaining coverage through options such as Original Medicare, Parts A and B, Medicare Advantage, Medicare prescription drug coverage, as well as Medigap. Next slide, please. So how do you find your local SHIP? Well, I'd encourage you all to go to shiphelp.org or call 877-839-2675. This service is provided by the SHIP Technical Assistance Center, which serves as a central source of information for our grantees, but also hosts the SHIP locator. So that will get you connected to the SHIP in your state, and from there you can find out how to get connected with the one in your community. One thing to note, though, is that, well, I guess two things. SHIP may be known as something else in your state, and the name would be available on this website. Sometimes it's Shine or High Cap or a variety of things, but all the services are the same. And additionally, if you would like to partner with your SHIP for education, it is a very busy time of year with open enrollment. So you may want to wait until December or early January to reach out, and they can really connect with you and help you with this Medicare education. And I believe that was my last slide. Yep. Thank you.
Thank you, Maggie. And I can personally attest to all the great work that the SHIP does. I used to work for one. And so, as Maggie was saying, they do really great work. And they have been around for so long, and it's still a little well-known, kept secret. If you know anyone who is on Medicare, you know that they get the really big Medicare and U book every year. And on the back of it is actually will also have the contact information for your local SHIP. Okay, obviously, we cannot talk about resources that are available without talking about ARP resources. So you can go on arp.org/Medicare and see all the latest information pertaining to Medicare. And if you do not, and there's an area on the site where you can ask questions, or you can search for your question. If you don't see your question there, then you can ask your question, and then you'll be notified when that question has been answered. A really great tool for those who are new to Medicare is our Medicare enrollment guide. And this you can see you have two different options: view your situation or explore the guide. When you view your situation, you answer a few questions, and it will give you a couple of paragraphs on what you need to do. Or you can explore the guide, which it will give you a more in-depth learning on Medicare and what all your options may be. Also, we have a whole section dedicated to Medicare and employers. So this is a really great information time so you can kind of see different webinars that are coming up and different online tools that we have that are available to you. Okay, and then we will have a poll coming up. So please, please, please stay here and where we can do the polls with you. But thank you for coming, and I hope you have learned a few things. And please stay on to take the poll, and also for we can answer all of your questions that you may have as well. And so we will start beginning answering some of your Q&A that you have came through during the chat, or feel free to answer or ask more.
Well, thank you, Xavier. While the poll is up, we encourage folks to go ahead and use the Q&A button to ask any of your questions, and do respond to that. It is helpful for us to kind of get that feedback as we continue to work on providing the best in class information and programming to you all. So just give a second to kind of go through that. But while folks are starting to enter in some of their questions, I think I see a lot of different people having some specific ones to their own. But I know there's some confusion, Xavier, about the kind of distinction between small employer 20. Could you just kind of go over that again, so folks can take a look and think through that? I'm happy to go back to the slide, but I was wondering if you can just kind of hit home some of those different pieces again.
If you could go back to that slide, that would be great. And so, depending on the size of the number of people who work there, the number of employees, depends on what you can do with your Medicare when you first become eligible at the age of 65. So if you work for an employer that is fairly small, 20 people or less, then you have to enroll into Medicare. Unless you get your insurance through a group health plan, and one of those employers in that group health plan has more than 20. Otherwise, if everyone in the group health plan has less than 20 employees, then it would still be structured like your small employer. So like I said, 20 or less, you must enroll into Medicare unless a group health plan. And that you would need to talk with your HR department to see if you are in a group health plan and if they have someone who is large enough to qualify for that exemption. If you are from a large employer, which are 20 and above, then you have options when it comes time to Medicare. You can decide to delay your enrollment. You can go ahead and enroll in Medicare, or you can just enroll in Part A and delay your Part B. And so it just really depends on the size of your employer and what you would like to do if you have a large group. Whereas, like I said, with a smaller group, you don't really have a choice.
No, thank you, Xavier. And I know, that's one of the things that we like to make sure we educate small businesses on, is that many of your employees may not know the true size. And so I think that 20 distinction is really important. If you are, again, do not have, are not part of a multiple employer plan or multiple group health insurance plan that has at least one business that has more than 20 employees. So it's good to kind of chase down some of those information now. I also want to hit home, and Xavier, if you can maybe go and talk about, there's all these different parts of Medicare. We already get see a question from Deborah about talking about Medicare at Part A again. And so I was wondering if you could do that kind of high level, the different parts, but also talk a little bit more about the penalties, because that's one thing that we see is that, we're trying to make sure folks know the information so they can avoid these penalties, because some of them are quite serious and can affect you for life. So I was wondering if you could just go over that real quick and talk about, I'll bring the slide up, the different parts and the penalties that folks may get.
Yeah, so your Part A is going to be your hospital insurance. So that's going to be when you're in the hospital, your rooms, meals, nursing services, lab tests, x-rays, some blood transfusions. And then you're going to have your Part B, which are going to be your medical. So when you go to your primary specialist, that's where those are going to fall into. They have a host of preventive services that they cover that are included in Part A. Your durable medical equipment, which is going to be like your walkers and wheelchairs, but also in diabetes supplies are going to be all covered under Part B. Next, I'm going to skip over C and go straight to Part D, which is going to be your drugs. So this is going to be your prescription coverage for it. And what your Part C is, it combines your A, B, and D into one comprehensive plan, which are going to be structured like your employer-sponsored healthcare. You're going to have your HMOs and PPOs going to have to deal with in and out network. And they may have additional services covered, like hearing, dental, or vision, but please make sure to look in the detail to see how comprehensive they are covered. There is a penalty that is associated with Part A, Part B, and D. Your Part B and D will stick with you for a lifetime unless you qualify for assistance programs like Extra Help or a Medicare Savings Program, which will help pay for some of your prescription drug costs and some of your Part B expenses as well, if you get a Medicare Savings Program. So for Part A, you pay 10% increase for your monthly premium for twice the number of years you did not sign up. So if you did not sign up for 2 years, you would pay that penalty for 4 years. Part B penalty for every 12-month period that you go uncovered, then it will be a 10% increase. And like I said, this is 12 months. So for every year you go uncovered. So if you go 11 months uncovered, you will be okay. It would not have to pay a penalty. For Part D, though, is for every month that you go uncovered without credible drug coverage. And you have to pay 1% of the national base beneficiary premium cost. So for this current year, it's $32.74. So for every month that you would go uncovered, you would have to pay 1% of that on top of your Part D premium plan cost.
Okay, that's really helpful. And just kind of go over again. And then I know I see a question in the chat about kind of how Medicare works with couples, particularly making decisions about who's primary and secondary. And I don't know, Maggie or Xavier, if you can talk about that generally. Obviously, there's a question about the small employer size related to their question, but I think just helping people understand how does this work with your partners or spouses.
Would you want me to answer the question? Okay. So if your spouse is covered on your plan, they can continue to stay on it. There are still have to follow the same type of rules with the number of employees and different things, but as long as they have the coverage, they'll be fine. But as soon as you would retire, then you would both then just qualify for a special enrollment period and can enroll during that time. And it's important to note, though, when selecting an actual plan, to select for yourself and not select the same plan for your spouse.
And I know you mentioned a little bit around the enrollment windows. Considering today's November 1st, I wonder if you could talk a little bit about just what those enrollment windows are again, so folks can know the difference, particularly between initial enrollment and open enrollment, because I know there's lots of questions around that.
Yes. So your initial enrollment period is going to be when you first become eligible for Medicare. It doesn't matter if you first become eligible because of your age or through if you're on your 25th month of disability, ALS, or end-stage renal disease. Whenever you was that's when you first become available. Keyword is initial. So when you first become available, or when you first become available to apply for a Medicare or enroll into Medicare. Your open enrollment period is what happens every year. It doesn't matter when you enroll. You could enroll into Medicare, let's say in September during your initial enrollment period, and then open enrollment period starts in October. You can still go in and make a choice, make a decision, and change your plan for the upcoming year. So open enrollment is just a time during October 15th through December 7th, same time every year, that you can go in and shop around again for your plan. And this is where you can decide if you want to stick with the original Medicare and get a different Part D plan, stay with your same plan, go to a Medicare Advantage plan, go to a different Medicare Advantage plan. This is just your time to shop around and see what is best available for you at this stage in your life. It is also important to note there is a Medicare Advantage open enrollment period, which is January 1st through March 31st. And during this time, if you have a Medicare Advantage plan and you decide maybe you're on a new medication or you have a new doctor and it's not covered, or say if you just were so busy during October 15th through December 7th, you just couldn't shop around, and you have a Medicare Advantage plan, you can take this 3-month period at the very beginning of the year and shop around again. And during this time, it's only for those who are enrolled in a Medicare Advantage plan. So during this time, you can switch to a different Medicare Advantage plan, or you can decide to go back to original Medicare and pick up a Part D plan.
So, well, Maggie, you talked a little bit about the ships. And so I was wondering, you kind of mentioned briefly that employers can partner with them. And so, I was wondering if you could expand a little bit about what that partnership could look like and what you've seen to be really successful as SHIP has kind of partnered with outside groups.
Yeah, sure. So the ships are able to provide education for your employees. So if you want to provide a session like this, where you can help your employees understand what Medicare is and how it might work with your insurance, they're able to come and do that. They can help with counseling. That you can have your employees call them if they have questions and want to understand how everything works together. So the ships across the country have partnered with a variety of different workplaces to provide education like this. So I'd encourage you all, if you have a lot of folks who are becoming Medicare eligible or are Medicare eligible, to connect with them as a really good local resource. And additionally, if you have folks who are providing a lot of caregiving for older adults in their lives, it's really helpful for them to understand the Medicare process as well.
I like to call the ships kind of the best kept Medicare secret. I mean, they are really just such fantastic resources for so many different people. So definitely lean on them and do your best to reach out. We did get a question from Carol, kind of with a clarification on premiums and as it relates to income level. And her question is specifically: is the income based on last year's tax? So 2024, would it be 2023 and et cetera, or is it pre-retirement income? I think it's just some clarification about that kind of level, about where that is.
Yeah, so the income that they use is a 2-year look back. So it would, if it's in 24, they'll look at 22. And so it's one of those things that, as I mentioned earlier, if it's in 22, you're both gainfully employed, and for some, and during this year that's not the case anymore, it's significantly lower. There is a process you can go through to appeal through Social Security to make it to where they will reassess your income to make it to where it would be more appropriate.
Thanks for that, Xavier. And then just, finally, as we close out here, what resources would you direct outside the ships, obviously, but what resources would you want to really highlight for people to take a look at and to learn more or to better understand how to support their employees?
Yes, ARP, we have a lot of resources, and we have a center that is specifically for employers. So please take a look at that. You can also refer people to our Medicare enrollment guide for they can kind of go through and look to see go through a training for they can learn more about all their options and different things. And we are in the process of making it updating it to include those with disability. And I do believe we're about to get it translated into Spanish as well for those who speak Spanish. So definitely be more of a comprehensive tool for all.
And then finally, to Maggie and Xavier, what's one thing you want folks to kind of take away from today's presentation as they think about how to support themselves or their employees who are approaching Medicare age?
As Michael Jackson said, you are not alone. So just remember, there are people out here that can help you and are willing to help you navigate this along with your employees. So don't be afraid to reach out and use the tools that are provided to you.
Yeah, I would echo that. I think this is complicated, right? You saw everything that Xavier shared. There is a lot of different moving parts depending on, what you need. That varies as well. Someone in the chat asked about how does this work with Medicaid? That's a whole other thing to cover. So, I would just encourage you to, reach out. You can reach out to the ships. You can reach out to your colleagues at AARP, and also Medicare.gov and 1-800-Medicare are great resources as well. You don't have to try to figure this all out on your own. There are people to help.
Wonderful. Well, I know we're at time here, and so thank you all for joining us, and hopefully this kind of was a good overview and a real start along your journey as you work to support yourself or your employees as you become Medicare eligible. And just thank you again to Xavier and Maggie for the wonderful presentation and all the insights. It's a lot to cover in an hour, so we just really appreciate everyone's attentiveness and joining for us today. But thank you all again for joining. We really appreciate it. But now this is kind of the end of the webinar. So thank you and have a great rest of your week.
Thank you.
Thank you.
Bye, everybody.